we're going to go ahead and get the other few witnesses, and you can stay down there somewhere. Anyone else that want to speak? All right, John Seelig is next.
Thank you, Mr. Chairman. I'm John Seelig, Director of the Arkansas Department of Human Services. Senator Irwin Stark mentioned that this bill was really around transparency and just reporting. If that was the case, we really wouldn't have a problem with it. But we agree with the Attorney General's office that the way the bill is written, you cannot implement it unless there's already a law in place specifically saying that you can implement the Patient Care Affordability Act. No such law exists as far as we know. What that means is that even though we're not required by law to have a Medicaid program or to implement the pieces of the Medicaid program that are tied to this law, if we don't implement the mandated pieces, we will not have a Medicaid program. We have 775,000 people on Medicaid in Arkansas. We pay for most of the nursing home costs. We pay for most of the births in hospitals. We pay for services in the area agencies on aging, community mental health centers, developmental disability providers. We would not have a Medicaid program if we're not able to implement what's required in this act of the Medicaid program. We think the law clearly says, as this is drafted, that we won't have that. We understand that the Beebe administration offered an amendment to make it clear that it was just reporting, and that amendment has been rejected. But this would be very serious for the Medicaid program. The other thing I'd point out is while there are controversial pieces related to health care reform, I think there are many pieces in this law that are not controversial, at least I hope not. There are pieces in the law, many pieces, that help seniors and people with disabilities stay at home and in the community. We would not be able to implement those. And probably most importantly, there are pieces of the law that help us tighten up on fraud, waste, and abuse in Medicaid, and we cannot implement those. In fact, one we're required to implement, I believe, in 6 days from now. If we don't implement it, as a result of this law, because we don't have any existing state law giving us that authority, our Medicaid program would be at risk immediately. So those would be our primary concerns about this law.
Thank you.